Hi, I'm Gary White for Channel 6 Central Kentucky Television. I'm here with Dr. Johnny Isaacs from Isaacs & Isaacs General Dentistry on Bobolink Drive in Springfield for our dental information segment each month, right?
That's right. It's once a month we kind of get together and talk dental terms, or something topical in dentistry.
That's right, and today we're going to talk about something that everybody loves, and that's root canals.
Exactly. Don't you love it? I thought that I've been doing quite a bit of root canals lately. This whole week, it seems like we're doing a lot of root canals, and everybody comes in with the same thing. They're a little anxious about it. There's a lot of fear in their eyes, and what happens, and that's really the root canal appointment. And I want to kind of go over a few things. But a lot of people will have what's called a pulpotomy done first, and that's usually not any problem. And then they get home and they start talking to their neighbors and their family members, and they say they're going to have a root canal, and everybody scares them. They say, "Oh my goodness, don't do that! That's terrible. It's going to hurt." And I had one and it was terrible. That's what you always hear. Or the old urban myth. I know somebody. I know a friend of a friend had one and it was terrible. So it always builds that way. And and we're all the same, and I would do the same thing too. But I've had a root canal probably 30-some years ago now, but and it's not bad at all. But let me kind of go through it and why it has that reputation, or why I think it is. I've been doing this about right at 30 years or so, doing dentistry. Or I was in dental school. Started dental school in '84, so I've been doing this about 30 years, and everybody's always, when you say the term root canal, everybody gets a little anxious. So years ago, I even tried to change the term. I started saying, no, we're going to do endodontics on it, which is really what dentists call a root canal. A root canal is it's kind of a misnomer, because the roots of the teeth have a canal in it. So we just call it a root canal. We probably ought to come up with something better than that, but the name kind of stuck. So what a root canal is, of course, first you numb the tooth, and then after it's numb and you can't feel anything, then we take what's called a handpiece. Everybody calls that a drill. We have a euphemism for it. We call it a handpiece. That's a dumb name, but it works, because we never want to say drill in front of the patient. Sorry, folks, it's a drill, and I know it is. And we have drill bits. We don't call them drill bits. We call them burrs.
Okay.
Because we don't like to say drill.
Right.
So we take the handpiece and the burr, and we tunnel. I don't have my graphical training aid, but inside the tooth we drill down, and we prep. We don't drill. We prep down inside the tooth and clean out the necrotic or dead tissue inside of it. Then we take these little instruments and we clean out the coronal, or the top part of the nerve, and that's called the pulp. We clean that out, and then we take an instrument and go down into the canals of the root, and that's where we extirpate, we clean out the nerve tissue with a little. It's called a barbed broach. It's a little. If you want to think of it, it's like a little tiny piece of barbed wire. It's sterile, and it's small. You can't hardly see. You can feel the barbs on it, but you can't really see them. But you take a little broach and you clean it out, and then after you do that, let's just use a molar tooth. A molar generally has 3 canals on it, sometimes 4, depending on the age of the patient. But generally has 3 canals. So you clean out all 3 canals. You put what's called formicresol, which is formalin, or it's a form of formaldehyde, and you embalm the tooth. You just and what's embalming do? Well, it kills the bacteria and allows the tooth to kind of calm down. We'll put them on an antibiotic, generally amoxicillin if they're not allergic, or some kind of broad spectrum antibiotic to kill the bacteria so it doesn't spread, so they feel better. Not everybody will need an antibiotic, but I'd say most people do. If it's necrotic or they're having pain with it, we generally go ahead and give them an antibiotic, and pain pills if they need it. Pain pills, sometimes we use a narcotic. We're trying to get away from the opiates, just because of all the abuse that's associated with it. And we have that problem here, as you very well know, in this area. So we try to keep the prescription down as far as the opiates. Now, then after we do that and it's calmed down, everything's fine, we bring them back in about 2 weeks, 2 or 3 weeks, and I generally like to do it in the morning, a morning appointment, because everybody's fresh and we're already prepped and prepared, and we got the room ready to go, because they're a little tedious. So we like to do it, uninterrupted. We have several times that we have to break to take an X-ray, or to just let the solution kind of work its way into the canals. But essentially, we just take a series of files, and these are they're little dental drills, little files, and we clean them out very delicately. But these things only go a dental handpiece, the one that people are familiar with, that high-pitched whine, that thing goes about 100,000 RPMs, and that's where you get that noise from the turbine.
Wow.
So that thing is going 100,000 RPMs. So this thing only going about 1 to 300 RPMs. So it's barely turning. It's just turning about like that, and it cleans it out. So we got to be real careful to clean the stuff out. And then that takes about a half an hour or so to clean it all out. After it's cleaned out, then we use a solution, sodium hypochlorite, which is essentially bleach, and we use the bleach water to clean that out. And then we've got it. We got all the debris out of it. We've got it essentially. It's not sterile, but it's essentially sterile. It's sanitized. Years ago, they would actually try to get the inside of the tooth sterile. Very hard to do. When my dad's a dentist, and when he was in school, he said they had to prove that it was sterile in there. He said it was almost impossible to do. So you had to be creative to get it sterile. But we don't do that anymore because of antibiotics, and because our techniques are a little bit better than they were back in the 50s and 60s. So it doesn't have to be sterile, and we don't want it sterile. So after we do that, then we fill it. Most dentists now are filling it with something called Gutta-Percha, which is it's a rubber it's off the coast of Africa, I believe, or Indonesia. I can't remember exactly where it is. I Googled it one time and I forgot where it is. But there's a Gutta-Percha tree. It's a tree, and it's a real soft rubber, and it has a very low melting point. So after we get the rubber or the Gutta-Percha warm, we place it down inside the tooth, and it will seal it off. And this Gutta-Percha has qualities that when it's warm, when you push it down, it actually expands a little bit, so it can push a little bit out the end, and that seals it off real well. So sometimes the patient, when you do that, they'll feel a little bit when I push it down in there. And what you're really doing is you're creating just a small air embolus. That if you think about the canal having air in it, well, I'm sealing this thing so well that when I push it, we're pushing that air out the end of it, and the patient will kind of feel just a little bit for just a few seconds, maybe a second and a half or two, and then it dissipates and goes away, and we know we've sealed it well when that happens. I actually like to feel that. I kind of warn the patient they might feel something, and then we seal it off. And that is, if it's a molar, you have 3 canals, and you do it. It generally takes about an hour and a half, something like that to do. If it's a front tooth, they only have 1 canal, the canals are bigger. They're a little easier to do sometimes on the front tooth, and they're of course easier to get to. And then after the root canal is done, then I put a regular filling in it. You could put amalgam, a silver filling, or a composite, a tooth-colored filling in it. But if you want to keep in mind, the tooth almost always needs to be crowned or capped. Really for 2 reasons. That we wouldn't do a root canal on a good tooth, so it needed a crown anyway. And once you do the root canal, the tooth is dead, but the ligaments holding it in there are alive, and all the bone structure is still around it. So you have blood supply to the ligaments and to the bone structure, but inside of the tooth is dead. So that can crack, and it will crack over time. So that's why we want to put a nice crown over it. Do that. I usually wait 6 months to a year just to make sure that root canal healed before we do that. So if you're getting a root canal, you ought to think in the back of your mind, yeah, I need a crown. And it's expensive. I mean, that's why we don't do a ton of them, but we take out more teeth than we do root canals. But I just want to kind of go over what a root canal is, because they have such a terrible name as far as in the public, and the jokes. And you can't, they're butt of all, the comic jokes, all the sitcoms. It's always a root canal. I'd rather do anything than have a root canal. Let me just kind of say this. I tell people it's sort of like, of course, nobody wants a broken leg. But if you go to the doctor and your leg's hurting, you think, man, that thing's hurting. And you go and they x-ray it and they say, you got a broken leg. You don't say, no, I don't want a broken leg. Well, that's what you have, and that's what you need. So whenever we take an x-ray and we say, oh, you need a root canal, a lot of people say, I don't want a root canal. Well, of course you don't want a root canal, but we only do them if that's what you need to fix the problem. So, but we get that a lot of times. People say they don't want a root canal. Well, if you need a root canal, then you only have really two choices. You take the tooth out with an extraction. A lot of times that's worse than a root canal, or you do a root canal. So that's what it is. So I like to use the analogy that it's sort of like going to the doctor with a sore foot, and he tells you got a broken leg, and you tell him, I don't want a broken leg. All right, sure you don't want it, but that's what you got.
And we're going to take care of it.
There you go.
That's right. Yeah, so that's a little bit about root canals. And if you have some more questions, you can contact Dr. Johnny Isaacs at Isaacs and Isaacs General Dentistry. They'd be happy to talk with you and help get you set up. And the phone number here is
859-336-7680.
And they're on Bobolink Drive in Springfield. This has been Gary White for Channel 6 Central Kentucky Television.